So basically, the carrier screening or the genetic compatibility test is a blood or saliva DNA test that is a study for the future parents and allows us to detect whether a man or a woman are carriers of a genetic disease that can therefore pass it into their children. According to our experience, 1 out of every 2 patients who undergo that test are carriers of genetic diseases without even knowing it, which means that even though they are carriers, they are not going to be affected and they are not going to develop it. But if both members of a couple, or in that case, if an egg donor and the husband of which we're going to use the sperm were carriers of the same disease, there would be a 25% risk of the baby having that disease, okay? Those genetic compatibility tests usually enable us to detect that situation, and that can occur by identifying a lot of genetic diseases that have very poor prognosis in the children, that would have a very important detrimental effect in the quality of life of the child born. So just cystic fibrosis, X-Fragile syndrome, spinal muscular atrophy, among other diseases. Okay, and then that test is a preventative measure that is performed by before starting the fertility treatment, and in order to determine whether the future father or the egg donor are carriers of this disease. And that way we can match and select an egg donor that, in the case that the husband is a carrier of some specific diseases, we're going to select a donor that does not carry those diseases to minimize that risk. Okay. Anyway, not all the genetic diseases are preventable through this test, because obviously those tests have limitations and do not test for all genetic diseases possible. But it is a very good way to reduce the risk of these genetic diseases happening.